Hello and welcome. Today, we're going to talk about something incredibly important: breast cancer. We'll explore what factors can increase your risk and, more importantly, what practical steps you can take in your daily life to reduce that risk. First up, let's talk about weight. Being overweight, especially after menopause, can increase your risk of breast cancer. You might wonder why. Well, our body fat produces a hormone called estrogen, and high levels of estrogen are linked to a higher risk. Now, this doesn't mean that if you're overweight, you'll definitely get breast cancer. It just means the chances are higher compared to someone at a healthy weight. So, what can you do? Try to lose even a small amount of weight. Losing just a couple of kilograms can make a difference. The closer you get to your ideal weight, the more your risk decreases. To do this, focus on your diet. Fill your plate with more vegetables and fruits. A good rule of thumb is to make half your plate vegetables, a quarter protein like lentils, fish, or meat, and only a quarter for rice or other carbs. Also, try to cook with less salt and oil, and avoid fried, fatty, and sugary foods. Our second point is breastfeeding. If you have a baby, breastfeeding is a powerful choice. Not only does it provide your baby with vital nutrients, but it also lowers your personal risk of developing breast cancer. So, if you're able to, it's a win-win for both you and your little one. Third, let's discuss smoking and alcohol. Both of these habits are known to increase breast cancer risk. What's really important here is secondhand smoke. Even if you don't smoke, being around someone who does can still raise your risk. If someone in your home smokes, gently encourage them to quit, or at least ask them not to smoke around you. Your health is worth that conversation. Number 4 is exercise. A sedentary lifestyle with little to no physical activity can increase your risk. Regular exercise, on the other hand, can significantly lower it. So, what kind of exercise should you do? Walking is fantastic. Start with a brisk 10-minute walk each day and gradually work your way up to 30 minutes. Swimming is another great option. Aim for at least 2.5 to 5 hours of moderate exercise per week. Just get moving. Fifth, let's touch on contraceptive methods. Some methods, like the combination birth control pill, can slightly increase the risk of breast cancer. However, this risk tends to decrease over time after you stop taking it. It's also worth noting that these pills can reduce the risk of other cancers, like uterine and ovarian cancer. Similarly, a postmenopause treatment called combined hormone replacement therapy, or HRT, can also affect your risk. The best approach is to have an open conversation with your doctor about the pros and cons to decide what is safest for you. Finally, number 6, X-rays and CT scans. While these medical tests are crucial for diagnosing illnesses, they do involve radiation, which can slightly increase breast cancer risk. Of course, when a doctor recommends a scan, the benefits of diagnosis almost always outweigh this small risk. The key takeaway is to never get these tests done without a doctor's professional advice. So, let's quickly recap the 6 things you can do to lower your risk. Maintain a healthy weight, breastfeed if you can, avoid smoking and alcohol, exercise regularly, discuss contraceptive and hormone therapy options with your doctor, and only get X-rays or CT scans when medically necessary. Of course, some risk factors, like getting older, are out of our control, but by focusing on what we can change, we empower ourselves to live healthier lives. Thanks for watching. If you found this helpful, please like, share, and subscribe for more health tips. See you next time.